ObamaCare is coming in with the Independent Payment Advisory Board, this unelected group known as the Death Panel. It's out there going to tell insurance companies what they are allowed to pay for, what procedures you're allowed to do. In other countries that have implemented this, it's based upon your age, on your usefulness for life. So it's this really scary government intervention in your health care. You've got these accountable care organizations. You've got all these different government entities that are created because of Obamacare that are coming in dictating to a doctor how they're supposed to practice. They're paying more and more for their malpractice insurance. Insurance companies keep reimbursing them lower and lower fees. Medicare and Medicaid keep threatening or implementing cuts in what they're paying them. Some of these doctors were making more net income in the 90s than they're making in 2012. So they're sick and tired of it, saying, I'm done. I don't want anything else to do with insurance. I'm going to go direct pay. I'm going to talk to my patients about how to pay for my services directly without third-party intervention. Pay me a small annual fee and then a small per-visit fee. Dr. Brooks did it really cool, $2 a minute. I love that. So now you want to book a 20-minute office visit. That'd be a long office visit. You don't really see a doctor that long. People don't think about it. It's rare you would see a doctor for 20 minutes.
But if you figure 15 minutes, if they go in and see a doctor at $2, that's $30.
That's what a copay is.
That's exactly what most copays are, so you're going to see that. But this is what's happening, especially with so many more people being brought on with the insurance. 30 million more people will now have insurance. If that's the case, I took supply and demand in college. There's going to be a big demand on doctors' time.
Think about it. 30 million new people are going to be walking around with new insurance card. Hey, I got my Obama bucks paying my insurance premium. Here's my health insurance plan. I no longer will be going to an emergency room. I need a doctor. We already have a shortage of primary care physicians. It's only going to get worse in 2014 with all these new people. The time it takes to see your doctor is going to expand. You're going to be looking at calling some doctor on the phone that you've never met before. You don't have a clue who he is. Electronic medical records, he uploads it and he talks to you. So telemedicine is going to be expanded, trying to take care of this. Or you can hire your doctor and keep your doctor through a direct pay method.
And that's the reason you need to do that, so you have a doctor to go see. That's the reason with Dr. Brooks, his success has been in the first month, I think they got over 500 people already signed up.
I think it's pushing over 700 already. It's been amazing how many of his patients really see the quality and the value of paying a very affordable $500 a year or $1,200 per family to sign up and get access to a fantastic doctor long-term, knowing that if you need to see him, you can call him. Most of the time, get a same-day office visit. You're going to get annual physical. A complete physical is included in this. $2 a minute. He'll even do a house call for his people that sign up for this program. For a doctor to not have to deal with insurance and waiting for the reimbursement, we know it's a fantastic plan. We know it makes sense for doctors. We think there's going to be a massive number of doctors that want to do this. But you're right. What does it mean for a patient? Well, I'm paying a health insurance premium, and I got to pay $500 a year more just to go see a doctor?
Because you can't give up your insurance. If you still need insurance, but you don't need the copay part of the insurance. So what if we just give up the copay part, Scott? Let's just say we don't want copays anymore. We don't want to pay for that because I've got a doctor I can go see.
That's why a direct pay physician works perfectly with a health savings account. You raise the deductible on your insurance plan. You move to a non-copay type health insurance plan because you cannot have copays if you have a health savings account.
Which will drive your premium down.
Exactly.
If you get rid of the copays, you can save quite a bit of money. That money can now be put into the HSA.
And you can use a health savings account then to pay for all your smaller medical bills.
What about the direct?
And a direct pay doctor's annual fee or his per visit fee. You can pay for that out of a health savings account because that's medically related expenses with tax deductible money. It's a win-win situation. It works perfectly. I am convinced that's one of the reasons why Dr. Brooks has had such an amazing turnout of his patients, showing them even within their employer group, they had an HSA option, but no one had explained it to them how, hey, this really is good insurance in the catastrophic scenario, which is the only reason to really have insurance anyway.
But let's say I've got a group plan at work, Scott, and it doesn't have an HSA option.
And that can be the case. But other times, what you could look at is a higher deductible. You can look at the out-of-pocket maximum. And the focus that we did and what we do, what we offer, is looking at your health insurance not from copays, because people are so focused on copays. That'd be like trying to decide which car you wanted to buy based upon the brand of windshield wiper blades. In my opinion, it's ridiculous. That's a non-issue. I want to look at the health insurance plan based upon maximum out-of-pocket.
But if it comes down to it and they don't have that option at work, okay, and there's going to be times for that, you can still run that through the FSA, which is your flexible spending account, and get a tax deduction when you pay the doctor his direct pay fee.
Unfortunately, the FSA is going to be limited to $2,500 for next year, but still, it's not nearly as good as a health savings account, but it is an option. Stop relying on insurance to cover things you can afford to pay on your own. Here's the most important thing. You really need to be doing a direct pay in order to keep your doctor.
Yeah, and I know with the direct pay docs and the HSAs, how well they work together. This is an area you've been spending a lot of time with, Scott. You put together a very nice video from our radio show last week. It's about a 20-minute video with some slides, different things, and they can go to, isn't it the blog site?
DirectPayDocs.com. DirectPayDocs.com will take you there, and you can listen to the last week's interview with Dr. Brooks. It's an amazing story. As he talked about, most doctors that move in this direction might have 100 or 200 people sign up within the first year, and he's pushing 700 in the first 3 weeks. So it's been fun educating his patients about insurance and then seeing them flock towards his practice, where he now has a way to stay in practice without all the controlling confines of insurance companies and Medicare and Medicaid dictating to him how he's going to practice in the future.
And I know he feels his success is really correlated back to what you did, was be able to go out there and explain how does an HSA plan work, how can they save money on premium, put it into an account, and then pay his services, and really understanding what he's doing really helped him with his success ratio, and that's the reason we're doing that with other doctors.
Yeah, we're going to offer this for all doctors out there need to be doing something like this. This is just amazing. There are effects of Obamacare. We're finding them out. We don't like what we see, but there are solutions also and new opportunities.